Health Watch is presented by UMass Memorial Healthcare. Here, caring for you.
Welcome to Health Watch, presented by UMass Memorial Healthcare. Today we're talking about maternal fetal medicine, a subspecialty of obstetrics diagnosing and treating mothers and their unborn babies. What is maternal fetal medicine?
Maternal fetal medicine is a specialty of obstetrics and gynecology that takes care of women with health problems that are pregnant or going to be pregnant. So women with, say, diabetes, hypertension, and we also do fetuses with a problem. So if a fetus has an anomaly that's noted by ultrasound, we would be the people to do the diagnosis, help the woman get care for the coming delivery, and also do any kind of diagnostic procedures that would be done.
How does maternal fetal medicine differ from typical obstetric care?
Typical obstetric care is for healthy pregnant ladies. And so there are women that have other chronic health conditions, like I just said. And so we would manage that health problem along with their pregnancy. Some health problems do not affect pregnancy very much at all, and other ones really do affect how you treat the patient. So we care for medically complicated pregnancies.
Who is a candidate for this type of specialized care?
Women with complications of, I guess I should say this pregnancy, but also complications of previous pregnancies. So there are women who had preterm birth previously. There are women who had problems with their deliveries that come to a high-risk obstetrician. So it's not only problems in this pregnancy, but sometimes it's a history in a previous pregnancy. Sometimes it's related to the increased risk of genetic disease, which is women over the age of 35 or women who have had previously had children with chromosomal abnormalities that we would then treat this next pregnancy a little different than we would somebody else.
What makes a pregnancy high risk?
So, it's all in the eyes of the beholder, right? So there's some things that you cannot change, such as your age. And so some of those things can be managed by a general obstetrician because they're high risk for a very specific kind of problem, which would be a chromosomal abnormality. And once you do the testing that sort of diagnoses those things, then the pregnancy can go on as normal. But there are conditions that impact pregnancy from the very beginning to the very end. Those would be, like I said, hypertension, diabetes are the two that come to mind because they're very common. But lupus, any kind of chronic illness that coincides with pregnancy is considered to be high risk.
Can a woman do anything prior to becoming pregnant to prevent a high-risk pregnancy?
I think it's important not to make women feel guilty about those kind of things. Most of the things that I care for cannot be prevented. What they can do is be better managed. So if someone has a chronic medical illness and is on certain medications, we recommend that people have preconceptual counseling. So before they attempt to get pregnant, they would meet with someone like me, a high-risk obstetrician, and we would review their medications. We would review optimal kind of times for them to get pregnant as far as like the control of their disease. And so they can't prevent themselves from having, say, diabetes, but we can start their pregnancy at the very best time, and we can manage their medications so that they're safe during pregnancy.
What tests can be done to monitor the health of an unborn child?
One is as simple as a mother feeling fetal movement. So later on in pregnancy, we say, you should pay attention to when the baby moves. And if the baby doesn't move, then you should come in for care and we can check the baby out. Other more complicated things at the very beginning are the things that we would check for chromosomal abnormalities like amniocentesis, chorionic villus sampling for the well-being, the chromosomal well-being, right? So there's like a lot of different ways you can define well-being. And then later on in pregnancy, we look at a baby to see if it's moving. It has a practice breathing movement that makes that fetal well-being. And we can also listen into the fetal heart rate and see if it has reassuring patterns. So there's like a whole continuum throughout pregnancy of how you reassure yourself that the pregnancy is going well.
What is a level 2 ultrasound and what kind of information does it provide?
A level 2 ultrasound, what I like to call it, is like the baby's first or the fetus's first physical exam. So we can't touch the baby, but we can look at very specific parts of it. So we look at the brain structures, we look at the heart structures, we look at the limbs, we look at as much of the baby as you can possibly see. And then we look to see if there's anything of concern. So the difference between a level 2 and any other real kind of ultrasound is that the people who do level 2 ultrasounds I only do ultrasounds of fetuses. I don't do gallbladder disease ultrasounds. I don't do kidney disease ultrasounds. I just do fetal ultrasounds. And so it's a subspecialty of obstetrical ultrasounds that are done by specialists.
What are the benefits to both baby and mom?
The benefit, I think, is for a mother, what you hope to be is to be able to reassure her that her baby is normal, and so that she can be reassured that we looked at the kidneys, the heart, and the baby, and that it's normal. The other benefit, which is not a happy benefit, but still a benefit, is that the mother could know before birth that there was a problem with her fetus, and she can make decisions on the basis of what we find, and we can sometimes we can actually help the baby in utero to be able to do better once it's born.